Hello, hello, hello. Thank you so much for tuning in. We have Nurse Adrian joining us today. And let me add to the stage today. And again, because of YouTube regulations, words, instead of using certain words, we may say expired, unalive, mortality, et cetera, et cetera. But we wanted to talk a little bit about the Florida's free KILL law. That's not really what it's called, but it basically does not allow children of individuals that have expired, maybe due to wrongful death, or be able to sue, or people that are over a certain age. So discuss this specific case that happened. It's a very unfortunate case, and then what you can do to perhaps protect yourself. Nurse Adrian, anything that you want to add about that?
Yeah, I mean, I think that I'm more surprised about this law being in existence than the surgical error, which is, as horrific as the error was. I had no idea about this law, and it's been in effect and was upheld by the Supreme Court, 25 years ago. And it has some pretty serious ramifications because I think people make a lot of assumptions about malpractice and who can sue, and especially in the case of mortality and a patient error. So I think that in itself has pretty big ramifications for Floridians.
Before we get started, let's just have a quick, you said you wanted to promote your nonprofit, correct?
Yeah. So many of you know I'm on the board of a nonprofit, a patient safety nonprofit. It's Pulse Center for Patient Advocacy, Education and Advocacy. I'll pop a link in the chat and you guys can take a look. I believe I have it on my link tree somewhere. But yeah, so this is a nationwide nonprofit for patient safety. We're one of the oldest nonprofits in the country. And we've actually, been able to change policy and law and been endorsed by the Joint Commission. The Joint Commission actually uses some of our materials for patient safety. And National Patient Safety Day was actually founded by the founder of the organization, which is a pretty cool thing. So, we're coming to you with the spirit of patient safety and critical thinking. And, we always want to lead with that. We're not sensationalists about things, right? I mean, this is a really serious issue, and it's not an isolated one. So that's, yeah.
Yes. All right. Well, let me add this to the stage. And then, so again, this happened in Florida, and this couple I believe they own a vacation home in Florida. They don't reside here around the year. But civil and possible criminal charges are being considered after the death of an Alabama man who expired when a surgeon at Ascension Sacred Heart mistakenly removed the patient's liver instead of his spleen, causing immediate and catastrophic blood loss, resulting in death. Bill and his wife, Beverly, are from Muscle Shoals, Alabama, and they were visiting their condo in Destin when Bill began experiencing pain in his left side. He was admitted to Ascension Sacred Heart Emerald Coast Hospital over suspected medical problems with his spleen. The Bryant's family attorney, Joe, in Pensacola, says the general surgeon, Dr. Thomas Shaknovsky, and the hospital's chief medical officer, Dr. Bacani, persuaded the Bryants not to return home for the surgery, but to have it in Florida, even though they were reluctant. Adrian, if you want to read.
Yeah, let me see. Is there a way to make this a little bit bigger?
I can. Is that better for you?
Yeah, I was trying to kind of move the chat over and make that narrower. Yeah, so let me put on my glasses. So it's one of the most egregious cases of medical malpractice that I've ever been involved with, said Joe Zarzner during an online press conference. The doctors kept suggesting it was too dangerous to move him, that his spleen could rupture, and they needed to go forward with the procedure. And that will all be, remains to be seen. But according to the medical records, provided to the law firm on August 21st of this year, Shaknovsky proceeded with a hand-assisted laparoscopic splenectomy procedure. During the operation, Shaknovsky removed Brian's liver, and in doing so, unfortunately transected the major vasculature supplying the liver, causing immediate and catastrophic blood loss that did result in Bill Bryan's demise.
And for those that are not in the medical profession, the liver is very vascular, so it makes sense that essentially he bled out to death by when something was inadvertently transected. Anatomically wise, I'm a little confused as to how this occurred, right, Adrian, because of where the liver and the spleen are located.
Right. I mean, I still remember the day I learned how to palpate a liver in nursing school on a patient, right?
I'm going to work on pulling up the organs. You can keep.
You dig, it's the one is on the left side, one is on the right side. Tissue wise, does it look the same? Similar, sure. But the question is a laparoscopic procedure. I just don't even understand because of the size of the liver.
Well, the liver is right upper quadrant, right?
Right.
And spleen is left upper quadrant, which is why he was complaining of left upper quadrant pain, and they correctly identify that it could potentially be a spleen issue.
Right.
So
and
how?
The spleen is about a third of the size of the liver. Is that correct?
So here, oh, wrong one. I pulled up the other because he's
Oh yeah, that's got like the pancreas.
He has 2 lawsuits. We'll get to that in a little bit.
Yeah.
So I have the adrenal glands because he also removed part of a pancreas as opposed to something with the adrenal glands. So
and that was in a prior.
Exactly. Yeah.
Right.
Yeah. Getting ahead of myself.
This is so we'll get to that. This is not the first time there's been an issue with this surgeon, and this is complicated. How do you know you're safe? How do you know when people sign, confidentiality agreements? It really cripples everybody else, honestly. And I implore people not to ever sign those because it then doesn't make any public record of any wrongdoing.
So, if we're looking at this patient, this is going to be the right upper quadrant, and this is left upper quadrant, right? So when he went in, he ended up removing part of the liver, right? Which is, again, in the right upper quadrant. Let's go back to this is the couple here.
The spleen kind of sits behind, if you saw that photo, the graphic, a little bit behind the liver. So it's kind of hidden. So it's, we would say, posterior to the liver. And oftentimes it's something that if you have a traumatic, motor vehicle injury, a gunshot wound, motorcycle accident, some traumatic injury, blunt force trauma, that's often when the spleen is removed or gets ruptured because it just is a big sack of blood. It's a reservoir of blood.
So Bill's wife of 33 years is devastated. She's actually a nurse herself. Her first inclination was to return home, where she said doctors were ready and waiting to treat him. But she said she was convinced that it was too dangerous because her husband might, quote unquote, bleed to DEATH if he was moved. Instead, he bled to DEATH in the operating room just 2 days before their wedding anniversary. So super tragic. She says, I know I'm not the only wife that has lost her husband suddenly, but the loss of my Bill was exceptionally unnecessary, brutal. So let me see, Adrian, if I can zoom this in for you.
Yeah, and according to the medical records, the surgeons did not realize his mistake at the time of the surgery and proceeded with the labeling. They removed the liver specimen as a spleen. After the procedure, Shaknovsky told Beverly Bryan that the spleen was so diseased that it was 4 times bigger than usual and had migrated to the other side of Mr. Bryan's body. That's a big statement right there. Typical human anatomy dictates the liver naturally exists on the opposite side of the abdominal cavity. It is several times larger than the spleen, said Zarsner. But, it wasn't until the pathologist examined Brian's tissue, that the organ had been removed, was identified as his liver as opposed to his spleen. The family was also told that Bill's spleen, the root of his original symptom profile upon presentation to the hospital, was still in his body and appeared with a small cyst on its surface, which that cyst could have been the cause of his pain.
Yeah, I think they're saying that it was that the cyst had ruptured and bled around it. I think that this quote isn't correct, but I think what she meant to say is like he hadn't lost, he didn't lose enough blood. Like it says he hadn't lost too much blood to live. I don't think that's that's what she meant to say. Like I
Yeah,
think what she meant to say was he hadn't lost enough blood that would like cause any life-threatening situation or that even required him to be transfused. So it wasn't as urgent or emergent as she was led to believe.
right. It's just for folks who aren't medical, right? Part of the assessment of, are you bleeding out? Are you losing blood? Or have you lost blood? Is to check a hemoglobin and hematocrit. They're very simple labs. Usually we do them every day in the hospital on patients. And although they may have not had a baseline on him, if he had been, with no other apparent reason, had been really low on the hemoglobin or hematocrit, that could have been an indication. Now, they could do two tests 8 hours apart, to see, is there a change? Is there active bleeding even 6 hours apart? So I'm really curious to know what his H&H was, to make that assessment.
Carol said this is such an extremely sad case. It truly is. So the legal teams also discovered that this is not the first time that this surgeon has mistakenly operated on the wrong part of a person's body. In previous wrong site surgery in 2023, the surgeon mistakenly removed a portion of a patient's pancreas instead of performing the intended adrenal gland resection at the same hospital. So these are the adrenal glands right here. They sit on top of the kidneys, and this is the pancreas. So yes, I mean, surgery is difficult, right? That's why they go to school for so long and study and complete all this training.
Yeah.
However, it's important that the job is done correctly and that there are ramifications for when it's not done correctly or consequences.
Yeah, and doctors do additional training to become surgeons, and this is usually anywhere from, I think, 2 to 5 years, depending on what they're training for. But it's a very serious, level of training that they go through to become. I'm assuming this gentleman's a board certified surgeon. So this is not complex anatomy. This is not open heart surgery. This is not transplanting a lung. This is not neurosurgery. This is
and it's like one thing if you
organs.
Not every surgery is going to be successful, right? There's going to be complications, but like you said, when you're removing incorrect organs, that's alarming.
Yeah, this is like these are landmark type organs that are not, they're not small, they're not hard to discern, they're not vague. There's a very, very advanced technology assisting surgeons. And the other thing that, I thought about in this case was, well, what about the rest of the team? There's a surgical nurse, there's a circulating nurse, there's probably a tech or another nurse, there's an anesthesiologist, who, has a view from the head down, seeing what's going on. And then if they're doing robotic surgery, there's a screen. So the doctors are typically looking at the screen, not at the patient, watching what's going on. It's a little bit like a video game, honestly, and that's kind of how they use gaming technology to train doctors in robotic surgeries. So there's a lot of questions I have about this.
In regards to like training with a lot of these robotic procedures, there was a documentary that in 2018 on Netflix. It was released. It was called The Bleeding Edge. And I'm not saying that this is the case with this robotic surgery or with all robotic surgeries, but um, there were several women that basically also ended up with like some expired, some with like terrible complications, wound dehiscence, like because the stitches weren't done correctly with these robotic procedures. And then what was alarming is that a lot of these robotic procedures, they were saying that the surgeons only received a certain amount of time to like practice or learn, and it wasn't enough. That when these new like so basically the documentary, it investigates the medical device industry, and it focuses on the lack of regulation and oversight for devices like surgical mesh, hip replacements, birth control implants. It highlights the potential dangers and health risks that patients face due to faulty or inadequately tested medical devices. And it also examines how these devices are approved and marketed to the public, often with devastating consequences for those who suffer from complications. And one of these that really stuck out to me was the Essure, which was a form of permanent birth control. And it was a little coil that they would stick in your fallopian tube, and it would cause scar tissue to form, blocking the tubes. And it was marketed as like this great, like minimally invasive permanent birth control, because personally, I've always known I don't want kids. So I asked my gynecologist if he would be willing to like perform surgery on me to tie my tube, like tubal ligation or burn them, whatever. And at the time, Essure was still in the market. He's like, no, I won't do that. But if you want, again, making decisions over women's bodies, because we apparently can't make decisions on our own, he recommended the Essure. And when I was reading on it, I was like, I don't know, but this sounds a little bit like it could, like putting a metal coil in my fallopian tube. Like, thank God, because I already have so much going on with my health. Thank God I did not have this, because I think if these women are living with like chronic PI, like pelvic inflammatory pain, some of them, the Essure has migrated and it pierced certain organs. Like, so a lot of these like medical devices or these new robotic procedures, it's not being regulated, and it's very dangerous.
Right. Yeah. And it's the, well, the other part is this, the surgeons getting trained on it, but also the rest of the staff. And sometimes because of staff, changes, there might not be a lot of training going on either, or can't maintain the competence level. And it takes, what I've been reading is it takes about 8 practices in each type of surgery with the robots to achieve competence. But there's also, I can't remember the term, but there's something where people practice too much, then they actually end up making errors. But I think that there's, we don't have really great research, as far as I could find, on current statistics on the rate of errors and reporting. A lot of stuff is about 10 years old or a little bit older, so a lot of technological changes have happened since then. But I think that it's surgeons need to be humble, and this is not something that surgeons are. Surgeons typically are rather arrogant. They're kind of have big egos. They're the cowboys of medicine. But when a patient asks a surgeon, hey, how many times have you done this? Which I've done myself. And most of the times the answer is, oh, I've done thousands of these. Yeah, I do my sleep, blah, blah, blah. Well, have you? Can you? I don't know. I mean, what is the right of patients to have disclosure, right? Are medical professionals obligated to say, I've had this many errors, et cetera? Now, certain types of surgeries do get tracked. Open heart surgeries get tracked. I think transplants in general get tracked. I'm not sure about all of them, but I know open heart surgery mortality after 1 year gets tracked. So, there are some things that are pretty important, but by and large, I think a lot of surgical errors just don't get reported because they're just not recorded.
Yeah, that's true.
They're
But
just not.
So ways, how can you protect yourself, right? You want to check medical licensing boards. And the thing that a lot of people don't know is that each state has its own like medical licensing board that maintains records. So you can't, there's just not one national database. You have to check that specific state. And that's why you were talking about like other people in the room. I don't know if you ever read or saw a documentary about Dr. Death, and it was that guy,
Mhm.
that surgeon that would operate on in like people's spines. And he was just like, he would just go in there with like a hammer
Yeah.
and just like completely egregious. And I do like several staff tried to speak up, but he just wouldn't listen. And he kept going from hospital system to hospital system, and I don't know if he ended up moving like states, and that's how he was able to go on for so long. But anyways,
Mhm.
so each state has medical licensing board that maintains records of licensed physicians and surgeons, and these websites often include information about disciplinary action or lawsuits. So for example, for surgeons in the US, check your state's medical board. You would have to go, for example, the Medical Board of California or the Texas Medical Board, and then you would search the surgeon's name to see any malpractice settlements or disciplinary actions. Now, if you are in healthcare, it's not accessible to the general public, but other healthcare providers can check the National Practitioner Data Bank. That might be a good idea if you're like recommending someone to go to a specific surgeon. If Another option is court records. So you can check online court databases for lawsuits filed against a surgeon, and many states have online databases of court records that are publicly accessible. Websites like Pacer for federal cases or local county court websites can provide information on malpractice lawsuits or civil cases. Let me add that here. I'm like trying to talk and do this at the same time.
Yeah, and I think if anybody who's watching this now or watches later on either of our sites, if you work in surgery, you're a surgical nurse, OR nurse, CRNA, tech, whoops. If you work in any of these arenas, weigh in on this, weigh in on what you think, the environment is. How is the environment? How is it received if you raise an issue? And what are things that, if you could tell patients a couple tips, what would they be? Because again, the data, when people sign these, confidentiality agreements, there's no there's no paper trail, right? You can't find anything unless there was some court case filed, but often they can get those sealed. So once there's a civil issue's been resolved. But again, I also looked in. I'm sure you know more than me, but I was looking into like what the criminal prosecution situation is in Florida, and it's really different because they don't have district attorneys, so it's a little different the way I can't even really get my head wrapped around it. But will this become a criminal case? At what point does something become a criminal case? And I think a lot of nurses that I've, seen on social media have weighed in on, well, if, Redonda Vaught got prosecuted and convicted and everybody else got off scot-free for lying about that particular case, including the doctors involved, medical examiner, and the board of nursing, this doctor should be prosecuted. This is negligence. This is an avoidable, absolutely 100, pretty much 100% avoidable error.
Attorney websites or legal databases. You can also use databases like, I don't know how to pronounce this, but is it Justia or Find Law to search for the surgeon's name in legal cases. And then State Department of Health or Insurance Commission. Some states have a Department of Health or an Insurance Commission that tracks malpractice claims. You can contact them to request information. Okay, so now let's essentially move on to like what this law in Florida is. And it's back in the spotlight because of this case. That's why we kind of discussed the case first and moved into it, because you needed to know why it's back in the spotlight. But Nurse Adrian, you summarized it when you and I were texting. Basically, what is this law? Like, why is it in place? Oh, you're muted.
The way I understand it, it's not legal advice. We're not giving medical advice.
Yeah, neither of us are lawyers, by the way.
Lawyers, like this is not any advice or interpretation. This is
This is,
Me,
and I put at the bottom like the actual name of the law or statute. Again, I'm not a lawyer, so I don't know if law or statute, whatever, but this is the actual like statute.
right. So this law, I believe, was brought about in about 25 years ago in response to the lack of the challenge of getting doctors, surgeons to stay in Florida with malpractice insurance rates just going skyrocketing, and the rates of doctors being sued, et cetera. And this is always a big discussion. Like, what is should there be limits on and caps on lawsuits, and how does a state or a jurisdiction attract doctors if malpractice is $100,000 a year, right? And so this law, but it's very unique. It's had several challenges, but it says only parties who may seek damages for pain and suffering and medical negligence claims are the decedent's spouse and minor children. This means that the parents are victims of medical error. Adult children over 25 are not allowed to file a claim. So the cutoff is 25. So that's not very old, because people that are more likely to have surgery are probably going to be older, thus having older children, and they might be a widow, right? They may not be married. Who knows the situation? This would also have dramatic, this really limits same-sex couples also, which I thought of. But so basically you cannot file a wrongful death claim in Florida unless you fall into those two categories for a medical malpractice claim.
So for example, like if my mom is divorced, is not married. So in this situation, his spouse, because they're married, she can pursue legal action. However, if something were to happen to my mom, I cannot
Correct.
potentially sue, is what this statute is saying. Um,
Right.
so yeah, and it's just, I mean, it's very unsettling.
It really is. And I've never, we all know there's all kinds of bizarre laws in the country, but this one is unique. There's no other law like this anywhere else in the United States, according to several sources that I was able to find. And so a couple of key impacts on it are eligibility restrictions, right, that we just talked about, and emotional and financial burden. So families cannot seek compensation. They must cope with the loss without the possibility of receiving justice or financial relief. So there could be medical malpractice that results in debilitation, physically or mentally, emotionally. You could be incurring massive amounts of medical or care expenses as a result of medical malpractice. So there's a lot of things to think about here. And so the financial hardship could be really significant for families. So the types of damages that are affected are economic damages, such as lost wages, medical expenses, non-economic, including pain and suffering, loss of companionship, or capped in medical malpractice cases. This cap often means that compensation awarded does not fully reflect the true extent of the family's loss and suffering, right? So, and I don't know if, I guess this applies to adults, because it would be different if it was minors, because minors wouldn't have decedents and spouses, theoretically. I mean, they could, obviously, if they're under 24, 25. So there's been some major, I think in 2000, it went to the Supreme Court. There's been several major legal challenges to this. So it's something to think about if you live in Florida. Really, you have a burden to do more due diligence in your healthcare and really research who's giving you care, what is the background of this individual, what is their history, and that information is not very easy to find. And when you're under stress and somebody's saying, hey, you're going to bleed out, you can't even make it back home to Alabama next door, 2 states over, 1 state, 2 states, then that's, your stress response is now kicked in. Nobody's thinking straight in that situation. We've all been there, even as healthcare
That's an
workers.
excellent point, because like for example, we talk about ways to protect yourself, but a lot of these are in non-urgent, non like acute situations. It's for, oh, if you're maybe you're having an outpatient surgery or with advance notice, but exactly in that life or death situation, you don't have time nor the capacity. Are you thinking clearly like, oh, let me look up all this information?
Yeah, and I mean, again, this is a very unique law, and the question is, has it been effective, right? And does it bring more people, more surgeons and physicians and providers to Florida? Has it done what it was meant to do? And it's interesting that the Supreme Court has upheld it. Yeah, it was 2000 they upheld it, defending its ruling with the states need to reduce medical costs. So that's the state's argument, is that this reduces our medical costs because we're not having to charge for these, add in the charges of these exorbitant malpractice insurance rates, which can be astronomically high. This is an issue for OBGYNs in many parts of the country. California has caps on medical malpractice. I don't know about for death, but in some cases, patients or families can sue in civil court also. So that remains to be seen. But again, you can file a charge against a physician or a provider that hopefully gets them, some consequences for their behavior from their licensing board. But it's not going to, do the same thing as being able to sue. Right. And so this is the tension in America between law, right? The trial lawyers. So this is the category we're in: trial lawyers and medical malpractice. And there's a lot of money in both lobbies. Let me put it that way. So in this case, obviously the doctors lobby won and the trial lawyers lost. But it is really significant. So.
And like you said, it's hard because sometimes we will see frivolous lawsuits where it's like, really, they sued for that, and not just in healthcare, but in like for any situation.
Right.
Like for example, someone breaks into a house and they hurt themselves, and this is something I actually read, and then the robber sued the house because they hurt themselves in the act of robbing their home. So, you have these kind of ridiculous lawsuits, but then other times when providers do need to be stopped because they're harming, like with that doctor death. I think the episode was on Peacock. Like he maimed so many people and
Right.
caused so much damage that like why wasn't he stopped sooner? So it's like there needs to be a middle ground.
Right. And, I mean, I don't watch a whole lot of TV, but I sometimes watch garbage TV like Botched, and just watch a few episodes of that. And you're like, I'll never have surgery in Florida. Because a lot of those people come from Florida, they've had their work done in Florida.
That's an excellent point. If I had more time, I'd go live more often, but that brings me to especially in Miami. Like if you're watching this and you want to have a BBL, be very, very careful about Miami because it is like super dangerous right now. It's definitely under scrutiny. It's being analyzed, but Miami is the city in, I don't know if Florida or nationwide, where it's like the most complications are occurring for BBLs, because these surgeons are having people perform the surgery that are not even the surgeons. It's just like an assembly line. They're having unlicensed individuals perform the BBL. One of them was like the receptionist did it. Sometimes the PA, they didn't mention a nurse practitioner, but like people that shouldn't be doing surgery were performing these BBLs. And so with the BBL, they're sucking fat out of another part, and with that cannula they can rupture organs. So just be very, very careful where you're having surgery. If it's too cheap, that's probably for a reason, right? Or if it's super affordable, it's probably for a reason.
Yeah, there's not, I mean, and there's medical tourism, there's all kinds of, arenas. And I'm not, a lot of people say, oh, I wouldn't go out of the country to get something done, or Thailand or Mexico or Colombia or wherever. I mean, you're running risk no matter where you go. You can't assume one going one place is worse than the other. I just pulled up some malpractice statistics. If you want, I can share a couple
Sure.
tidbits. Pretty interesting. This is saying, this is from Forbes, and this is 2024, but I don't know what the data timeline is. Okay. From 2022 and prior years, not sure how far back. But this is saying 1 in 3 care providers is sued for medical malpractice during their care. That's massive, right? That's huge. Care providers make avoidable errors in 3 to 15% of all medical interventions. Now, medical interventions doesn't mean always surgery. That could be a procedure, which is not necessarily a surgery, because misdiagnosis is a common type of malpractice. Cancer, infections, and vascular events are the conditions most likely to be misdiagnosed. Prescription errors.
Misdiagnosed or not even caught. So, for example, my uncle, he kept
Um,
going to the doctor with back pain, right? Complaints of low back pain, back pain, back pain. They thought it was sciatica. I don't know all the details, but come to find out, basically he has stage 4 lung cancer that ended up like migrating towards his spine. So that's why he was having
and
back.
is that here in the United States?
Yes, it was.
Yeah, and I'll tell you, the back situation is a really tricky one because the back pain algorithm is absurd with insurance companies. You've got to treat it like a musculoskeletal issue. I've heard many, many cases of back pain not being caught, and it was cancer in the end because of the algorithm required by doctors in the absence of any other assessment findings to, you've got to do NSAIDs. So you just basically have to do an X-ray, send the person home on NSAIDs for 6 months, come back, then you can maybe do a CT, etc.
I don't know all
So
the details, but I'm like, was an X-ray done? Like, wouldn't have the X-ray have shown something?
X-rays might not. A CT would, though. A CT should show something. Yeah.
I feel like it would show something. Like, I mean, think about like lung cancer. A lot of times they'll do a chest X-ray to rule that out, you know?
Yeah, I mean, if a dense mass is going to show up differently, certainly, and can in an X-ray, it really depends on the area and all the organs and everything, especially in the pelvic region, in the back region. You've got a lot going on, and just for example, like the bowel, the colon can show up, and really block a lot of things if there's stool in the colon, which normally there is. But yeah, I mean, it's terrible. This is a things like, so yeah, so this is like, prescription errors. 90 this is Listen to this, people. 96.9% of successful medical malpractice claims are settled out of court, which means there is no paper trail. There will be no paper trail because it doesn't mean it's, as an RN, we're like constantly under scrutiny, and there's so much accountability that we are held up to and thrown under the bus for. A doctor can get sued and a provider can be sued and not ever be reported to their board. It just that the rules are different, and they're different each state. There could be a lot of these are ethical issues that really need to be sorted out. But when you think about it, so we're saying 3% go to trial. 3%. So only 3 out of 100 cases are even going to have any public record, because I'm guaranteeing you that all those ones out of court are non-disclosures. They are sealed, and nobody can talk about it, which is really not okay. I think that's a big problem in America. These things, I just think, non-disclosures should be completely outlawed. What do you think, Bridget?
It's like there's not an easy solution to this, and I see it from the perspective of the patient. I see it from the perspective also of a provider, right? Um, so it's like that, like I was saying before, it's like that middle ground of not being like the need for like not for I would say like small things, or finding that balance between not getting sued for everything, right? Because as a healthcare provider, being sued is like it would be terrifying to me, imagine going to school for all those years and then losing your license. So it's like it needs to be a balance between not extremely punitive for I would say like non-threatening or non-life threatening conditions or
Yeah.
you know, but then on the other hand, like for example, my uncle that has stage 4 cancer that went undiagnosed for so long. Um, so, who knows if an X-ray would have shown at least a shadow, something, or
Right.
I
Well,
think
and also some labs. I mean, doing, the specific labs that might show some inflammation in the body.
well,
Some,
and he had a history of like, again, I don't know all the details, but he already had a history of cancer. So like
yeah,
as a healthcare provider, taking patients' history, thinking outside the box, for example, if someone's complaining of chronic cough for an extended period of time, maybe ordering that chest x-ray to see if everything looks okay instead of just sending them, I don't know, tassel on pearls,
right,
um,
right.
like, so listening, taking the time to listen to patients' history and story, and then from the patient side, advocating for yourself. So if
Mhm.
this provider is not listening to you and you feel like something's going on, maybe getting a second opinion, um, being persistent, right? I hear so many stories of women that had like colon cancer. It's more and more prevalent in younger populations, and they were basically like gaslighted for the longest. They were just told it's anxiety, and then they again colon cancer. So um just advocating for yourself, listening to your gut, see a different provider that maybe will listen, maybe will order those tests for you. Um, but yeah, and then voting for people that have our best interest at heart in
Right.
regards to like making laws that help patients as opposed to hurt them, and helping like laws that will hold people accountable when they need to be held accountable.
Yeah, absolutely. I mean, medical malpractice is the third leading cause of death in America, right? 9.5% of all mortalities in the US each year. So we have a problem in this country. And we're not, it's a systemic issue. It's so many contributing factors to it. It's not by and large people just out there wanting to hurt people. There's a lot of reasons why medical errors happen, whether it's a medication error, a misdiagnosis, whatever it might be. I mean, this is why many of us advocate for nurse to patient ratios, to have better staffing, to have,
And then from the provider standpoint, these 15-minute time slots, it's like,
right,
how can you think critically when you feel like you're on a treadmill? And again, these are set by not by the, I'm not sure if it's like the insurance reimbursement, but usually it's like the corporation that it's like, we're going to do 15-minute slots. And it's just like a revolving door of,
right.
and then so.
Yeah, it's different. And I mean, I'm in nurse practitioner school now. I'll be a provider in a couple of years doing psychiatry, which psychiatry has a massive malpractice rate for psychiatry, for doctors, for MDs. This is something I think about all the time because there are times when we have all made errors. We've all made some level of mistake in our careers or something that we think, oh, did I see that? And that's why I feel very comfortable as a nurse, really pushing on the providers. And I work with a lot of PAs, a lot of NPs, and pushing on them. Let's look at this. How can we rule this out? Like, let's not be rushed. Let's do one more lab. It could be this because you just don't know. You could be that patient that's got that 1%, 3%, 5% of a disease that matches your symptoms, and it's not a strain back, right? It's cancer. There's something else going on. And I think that's why in the end patients do have very good results with nurse practitioners as providers, because we do look at the whole picture as part of our training versus a little bit more one size fits all approach that medicine teaches. And I think that's changing. I think the practice of medicine is changing. I think younger doctors I see now have a bit of a different attitude about it. But again, I think in that general practice category, that's just an area where physicians are not staying. They're coming out, getting a couple years experience, what I see, and boom, they're off doing,
Yeah,
urology,
nobody wants to do,
nephrology.
especially MDs, like nobody wants to do primary care because it's so
Right.
taxing. And I've
And they're
said this
going into hospital.
before. I've said this before, like even NP wise, like the happiest NPs have specialized. Like they're working for a urologist or they're working in rheumatology. Like primary care is draining for everybody, for physicians, NPs, and and it doesn't pay, right? It doesn't pay, and yet they have to know so much about everything. Whereas like if you can specialize in psychiatry, you start to get really comfortable and you just start to see the same patterns over and over. So I feel
Mm.
like you know more in that niche and you're less likely to miss something. You can provide better care versus like knowing about a lot of things sometimes, even like maybe superficially. And I say that superficially, like, obviously we've studied and we know these things, but like it's a lot, versus if you know the ins and outs of psychiatry or whatever, or like in
Yeah.
telemedicine. Yeah, so
I mean,
it is a lot.
health is healthcare and medicine and the knowledge base that everybody has to have, whether you're an RN, the bedside, frontline, a provider, a PA, NP, a physician, a DO, whatever you are. It is so much. I mean, I would love to do acute care. That's been my background. I don't want to be a hospitalist. I don't want to work 7 on, 7 off, make a few dollars more than what I make now. To me, it's not going to get me where I want to be. And I know I just would lose my passion for it. But it's also that, wow, I look at like how we as a team, and I work in a team approach setting. We work together with the MPs, the PAs, the providers, the doctors, the supervising physicians, and oftentimes we're on one trajectory from 7 to noon. The doctor comes in, takes a hard left and says, no, we're going to look at something totally different for this patient. And then, the next day it's a different provider and they're going to make a hard right. So again, based on our own knowledge and our familiarity, we make different decisions about how to diagnose something or what we're assessing or what we're thinking may be the issue with the patient or what may be the treatment. And sometimes none of it works. Sometimes we end up right back at ground zero, honestly.
And I think too, as providers, we need to put our egos aside. And like you were saying, like listening to your nurses,
Mhm.
I mean, whoever, like your nurses or your techs, listening with an open mind and not having this ego of I know so much more than you, or I'm above you, or this
Yeah.
holier than thou attitude. Because when you start thinking that you are you cannot make mistakes, that's when you will make mistakes. When you are humble, um you're more likely to be like open and receptive to things and listen to your nurses that maybe have a different perspective or a different idea, because again,
Mhm.
um, you're with the patient a lot longer than like the provider is or the prescriber is.
Right. No, absolutely. Absolutely. And I think, the team approach is a good one. I think it's great, like for me to see the surgeons have PAs, NPs, everybody's got a team, the cardiologists. And these are not, a lot of these folks are FNPs and they've just kind of specialized on their own. So for those people who may be listening who want to be an NP or are going into that area, you don't have to even do the acute care route. I work with tons of FNPs in the ER setting. And it's
I would, yes, do they do it? Yes. But personally, and having been an FNP with the education that we receive, I really do. Like if you really want to work in the ER in the hospital, I highly recommend you get that acute care certification, because it will protect you in the case that you are sued, but also it will prepare you to be a better provider. And that's at the end of the day what we want to be, because
yeah,
from having gone through family nurse practitioner program, our education prepares us for primary care. It
yeah,
does not prepare us for the hospital. What I would know working in the hospital would be from my days as a bedside nurse, which is a lot, right? And I also know a lot of FNPs that work in the hospital, but like I really think that they should do their AMP if they want to work in the hospital setting.
yeah. Or have a residency. I think that this also speaks to like the residency issue too. having the access to residencies and
Mhm.
that on the job training is really important. But, the bottom line is, healthcare it is really difficult to navigate. It's really important for patients to do their due diligence. If you're traveling, if you're like, I would say, if you're a senior citizen or you may have health issues, if you're planning on retiring someplace, you should know what kind of hospitals there are. Is it a trauma center? What level? Do they have a cath lab? That's why I always ask my friends when they talk about all these places, they're going to retire to. Does the hospital have a cath lab? Because if it doesn't, you're going to be in trouble.
That's an excellent point too. I think, Destin, and that hospital, like Advent Health and Orlando Health, are the big hospitals in Florida. And
Okay.
even within Advent Health, like I always tell my husband, like if something happens, don't take me here, take me here, right?
Right.
I've never worked for St. Cloud Hospital. So I feel, and I don't plan, there's certain hospitals I won't name just because if I ever work for an organization, I don't want it on the record like, oh, she badmouthed this hospital. But
Right.
for example, St. Cloud Hospital, I would stay away from that, so like you bring up an excellent point of like, know which hospitals are better rated or higher rated or have a higher level of acuity. And unfortunately, like a lot of times these rural hospitals don't have the capabilities or the technology to like properly treat you.
Right. Or the EMS can't get you there in time. That's another issue. But I think, if you're going to be going somewhere on vacation, you're going to be, snowbirds, especially, or if you're going to go somewhere for a week or 2 weeks, you should have some general knowledge of where are the healthcare systems and hospitals. And, especially if you've got a chronic issue you're dealing with, then you might want to even ask your own doctors, hey, do you know anybody in this area? If I need to see somebody, do you have a colleague or somebody you went to school with or whatever? Right. This is part of like what we have to do. Like we know where the CVS is. We know where the banks are. You know what I mean? We know where all these things are when we travel. We need to know where the medical services are and have a little bit of knowledge about that. And, ask questions. Don't be afraid. Take a deep breath when you get that scary diagnosis and that stress response kicks in. Take a deep breath, take a minute and, start asking questions. Can you show me the CT? Can you show me on the X-ray? Everything can be pulled up. And if they don't want to do it, they have a PA or NP who can do it. Somebody needs to do that for you. So that's due diligence. And that's, an ethical obligation. And also, it's just part of consenting. If you're going to, before a patient goes in for surgery, they have to be consented by the provider. That is part of it, is an explanation. And there's really no excuse to not have visual aids. We all have a phone. We can pull it up ourselves. Hey, I've got this chart of anatomy. Show me what's going on. I looked this up. Is this what it is? We have a shared responsibility, and that's just the way it is in the United States.
And of course, and I do want to just kind of like maybe end on this is like we are definitely not like blaming this nurse spouse for what happened at all, because like when I was in Colombia, I had to have urgent surgery because my colon ruptured. And I didn't care at that point, I didn't know who was operating on me. I didn't know what they were doing. So it's like sometimes these things just happen, and unfortunately, it is just a tragedy, like you've brought up some excellent suggestions, but sometimes at the end of the day, no matter how much planning we do, like the inevitable happens and a tragedy sometimes happens.
Yeah. I will leave with this. States that you might want to consider moving to, they have the lowest number of reported medical malpractices cases. Vermont, Hawaii, Rhode Island, South Dakota, and Idaho have the lowest per capita.
Hawaii sounds good to me.
Yeah, exactly. So the payouts, this is interesting. The highest number of claims is California. However, the highest payouts were New York and Florida. So that's pretty, wow. It's pretty high numbers. So
a lot of things are happening in Florida, basically.
Yeah. Well, there's caps in California. So I think that's why the California is not in that top payout number. But yeah, check out if you guys want. There's a lot of resources. I put the link for Pulse in the chat. Check it out. Pulse Patient Education Safety. We have tons of resources there, which includes having your medication list. There's printables, downloadables, lots of resources there for anybody. It's all free. And that's the purpose of the nonprofit, is keep having available information around patient safety for the consumer and making things really simple. But thank you so much. This has been a really interesting, topic to discuss. And I'm really curious to see where this goes and what is revealed in the next couple months about this case.
Thanks so much for watching. Make sure you like, subscribe.